Okay, you're welcome to my class. It's me, Francis. Today, I want to talk about something very interesting. I want to talk about something very common in Nigeria. It's common in Africa. It's actually a disease. And then, what disease are we to talk about? We want to talk about ulcer, peptic ulcer precisely. So, in this class, we'll be looking at meaning of peptic ulcer. We'll be looking at symptoms of peptic ulcer. We'll also be looking at causes of ulcers, that's peptic ulcer, and the management of peptic ulcer. Okay, are you ready? Okay, so let's begin. So, what are ulcers, or what's an ulcer? An ulcer can just be a sore or open wound that can happen in any part of the body. It can be found on your skin, in the mouth, or maybe in the GI tract. Yes, by GI tract I mean gastrointestinal tract. So an ulcer simply means a sore or a wound, just like an open wound that can happen in any part of your body. Okay, so when we say GI tract ulcer or gastrointestinal ulcer, we are referring to a sore or a wound in the GI tract, in the gastrointestinal tract, or otherwise known as the alimentary canal or the digestive tract. Okay, so by GI tract, I mean all the organs through which food passes in the body of a human or a mammal. Okay, just like my beautiful dummy here. Um, if you look at it, it has a mouth and then the esophagus. From the esophagus, you have the stomach, which I have pulled out for the purpose of this study. You have the esophagus to the stomach, to the duodenum, which is the first part of the small intestine, and the large intestine. So all the organs through which food passes in the body of a human, collectively we call it the alimentary canal, digestive tract, or the gastrointestinal tract. Okay, so we want to be looking at ulcers that affect the gastrointestinal tract, beginning from the mouth down to the rectum. Now, the position of the ulcer determines the name of the ulcer. An ulcer in the mouth is called the mouth ulcer. An ulcer in the esophagus is called the esophageal ulcer. An ulcer in the stomach is called the gastric or stomach ulcer. An ulcer in the duodenum, which is the first part of the small intestine, is called the duodenal ulcer. And of course, ulcers in the intestine is called intestinal ulcer. Okay, so esophageal ulcer, duodenal ulcer, and stomach ulcer collectively, we call them or we call it peptic ulcer. So when we say peptic ulcer, we are referring to ulcer that can either be in the stomach or in the duodenum, which is the first part of the small intestine. So collectively, we call it peptic ulcer. So peptic ulcer simply means ulcer that affects the stomach, the duodenum, which is the first part of the small intestine, or maybe the esophagus as well. Okay, so that is that. Now I want to look at symptoms of ulcer. Okay, the symptom of ulcer is dependent on the type of ulcer you have. For peptic ulcer, the most common symptom is abdominal pain or a burning sensation in your abdomen. So that is one. And secondly, we also have symptoms like indigestion. You may also have heartburn, like a burning sensation in your heart. And sometimes you can even have symptoms related to acid reflux. Okay, so these are some of the symptoms of what? Of, of peptic ulcer. This pain can be immediately after meal, depending on the type of food you eat. Okay, so these are some of the symptoms of what? Of peptic ulcer. So what are the real causes of what? Of peptic ulcer? What causes peptic ulcer? Okay, like I said, um, an ulcer is a wound in the body. Okay, now what are the real causes of peptic ulcer? Now the stomach walls or the intestinal walls, that's the duodenal walls, have linings, just like I have here. Or now, if you look at this, is actually the stomach. What the stomach looks like, it's like a cut section of the stomach here. You can find out that there are some rough. The walls are actually rough here, just like what you have on the screen. Now, the walls of the stomach are actually rough. These are the lining that protect the tissues of the stomach from what? From the effect of the acid. Now, the stomach produces hydrochloric acid, and this acid is being prevented from affecting the tissues of the stomach by the stomach linings. Now, when there is an ulcer, ulcer may be a breakage or maybe a damage of the stomach lining or the duodenal lining, thereby exposing the tissue of the stomach and intestine to this acid. That's what leads to the severe pain. Okay, so this ulcer occurs when there is a damage in the lining that protects the stomach tissue and also the tissue of the duodenum. Okay, so that is that. Now, what causes this damage? What causes this breakage of what? Of the lining of what? Of the stomach walls and the duodenal wall. Now, of um, there are two main causes of ulcer. Number one is a bacteria called the Helicobacter pylori. Now, the Helicobacter pylori affects or destroys or damages the walls or the lining that protects the stomach. And so when that happens, it exposes the stomach to what? To the effect of what? Of this acid. So Helicobacter pylori is one cause of peptic what? Ulcer. Okay, so what is the next thing that can cause peptic ulcer? The next thing that can cause peptic ulcer is the prolonged use of drugs such as non-steroid anti-inflammatory drugs. These drugs are prescribed by doctors to fight inflammation and also relieve pain. So when we take this drug for a very long time, it causes peptic ulcer. So the prolonged or excessive use of drugs such as non-steroid anti-inflammatory drugs or NSAIDs may lead to what? Ulcer. Examples of these drugs are ibuprofen, aspirin, diclofenac. So some of these pain relief or NSAID actually causes what? Ulcer. Even though some persons may argue that fasting or not eating for a long time may cause ulcer. Well, that cannot be ruled out completely, but it's not a known or major cause of what? Of ulcer. The two major causes of ulcer is the bacteria called Helicobacter pylori and also the excessive intake of drugs such as non-steroid anti-inflammatory medicine. Okay, now we have known what causes ulcer. Okay, so the next thing is how can ulcer be managed? How can we manage or treat ulcer? Okay, since ulcer is an injury or a wound or a sore, treatment is geared towards facilitating healing. Okay, so the management of ulcer can be done in two ways. First of all, number one is to tackle the root cause, and secondly is to also tackle the acid in the body. Of course, if since it's in the body, it will be difficult for it to heal. Injuries heal faster when they are dry. It's almost impossible for an ulcer or an GI tract to be dry, right? Okay, so treatment is geared towards facilitating healing, and this can only be done by number one, tackling the root cause, and number two, trying to suppress the acid because the acid is the reason for the delay in healing. Okay, so if it is caused by the bacteria Helicobacter pylori, then antibiotics can be prescribed. There are good antibiotics that can treat Helicobacter pylori, amoxicillin, augmentin, ciprofloxacin, or some of these drugs can actually tackle the Helicobacter pylori. Okay, but then if your ulcer is caused by prolonged use of non-steroid anti-inflammatory drugs, then of course it will be best to actually put a stop to it. But then this shouldn't be done without the advice of a physician. So you don't just stop taking the drug without telling or informing um, your doctor. Okay, so after tackling the root cause, the next thing we have to look at is to suppress what? The acid. The first thing doctors will do is to prescribe a drug that will try to inhibit the effect of what? Of this acid. What do I mean by that? There are drugs that try to make this acid ineffective or powerless. Permit me to use that word. So there are drugs that make this acid powerless or ineffective. These drugs are called anti-acid. That's antacids. So antacids are prescribed by doctors to reduce the effect of what? Of this acid. Examples of antacid, we have Gestine, we have Gaviscon, we have Emtricil, and many of them, they can easily be gotten in pharmacy or shops around. Okay, so these medicines help to do what? To make the acid ineffective. They don't stop the body from producing the acid. They make the acid ineffective. But then after the effect of this drug is over, the acid regains its power and become powerful again and strike again. And so because of that, doctors try to, your doctor will recommend you taking drugs that will prevent the body from producing acid instead of just suppressing the effect. Instead of just trying to make it ineffective, doctors prescribe drugs that will try to prevent the body or at least reduce the body's acid production level. Okay, these drugs are called proton pump inhibitors. Now, proton pump inhibitors are drugs that are prescribed to prevent the body from producing acid or reduce the rate at which the body produces this acid. Examples of these drugs are omeprazole, pantoprazole, domperazole, and some of the drugs that ends with the suffix zole. Now, these drugs are saddled with the responsibility of reducing the or even stopping the body's acid production ability. But then, these drugs shouldn't be taken for a long time because the acid in the body, the chloric acid, is very important that the body cannot do without it for a very long time. So, what are the importance of this acid? This acid helps to digest certain food like protein. The acid in the body also helps to keep microorganisms that are ingested alongside food. So sometimes when we eat our food, there may be some microorganism there in the food. So this acid helps to ingest this, helps to kill these microorganisms. The acid can also even dissolve foreign bodies. What are foreign bodies? Those materials that are eaten without us noticing. So as long as it's not part of the food we eat, it is referred to as what? As foreign body. The acid in the body can even dissolve metal. It can even dissolve bones. So the body needs this acid. Okay, so the body cannot survive a long time without this acid. That's why this drug shouldn't be taken for a very, very long time. Okay, but then there are also another treatment that needs to be done. Apart from treating medically, there are also some lifestyle changes that probably you will need to do in order to facilitate the healing of ulcer. And so, what are these lifestyle changes? Number one is by not eating a large chunk of food. You can actually divide your food into fragments and then eat them instead of eating them all at once. And secondly, by not eating and then going to bed immediately. So these are some of the um, ways we can protect us. I hope you enjoyed the class. See you next time. Till when next to meet. Thank you very much and God bless you.